Welcome to Start to Carry You Online Nursing Channel. This is the Part C video of Safdarjung Hospital New Delhi Nursing Officer Exam Model Questions. In this video, again we are going to discuss 20 multiple choice questions. These questions are selected based on the previous question papers of various nursing officer exams all over India. Let's go for today's video. Before going to today's video, I like to congratulate all those who have selected for AIMS Nursing Officer exam, which was held on 2018 September 16. We wish your dreams will come true. At the same time, we are telling for all those who have got disappointment in the result of the AIMS Nursing Officer exam, don't worry, you can achieve till you have time. You have more opportunities in your hand. You will get a better opportunity in a correct time. Okay, now go for first question of the day. Dressler's syndrome is medically known as option A, acute myocardial infarction syndrome, option B is chronic myocardial infarction syndrome, option C is post myocardial infarction syndrome, and D is pre-myocardial infarction syndrome. Dressler's syndrome, it is a secondary form of pericarditis. It occurs after 2 to 10 weeks post myocardial infarction. So this is the right answer. Question number 42. Ashkoff's bodies or nodules found in heart is seen in which conditions of patient? Ashkoff's bodies or nodules found in the hearts of individuals with rheumatic fever. These result from inflammation in the heart muscles, and it is characterized by rheumatic heart disease. So the right answer is rheumatic fever results in Ascoff's bodies in the muscles of the heart. Question number 43. The most common viral pericarditis occurs from option A adenovirus, option B is mumps virus, option C is Coxsackie virus, option D is ecovirus. The most common viral pericarditis. These all are viral agents which may cause viral pericarditis. But which is the most common viral pericarditis? In this four, the most common is Coxsackie virus, which cause viral pericarditis. Question number 44. The site for absorption of iron in our body is option A duodenum, option B jejunum, option C ileum, option D both A and B. The site for absorption of iron in our body is the right answer. The iron absorption takes place in duodenum and upper part of the jejunum. So the right answer is both A and B. Question number 45. At the time of damage to cardiac muscles, the protein which is released in more amount is option A is angiotensin, B melanin, C troponin T, and D is calcitonin. So which protein is released more at the time of damage to cardiac muscles? The protein known as troponin T are released when there is damage to the heart muscles, which occurs due to heart attack. More damage, then there will be more amount of troponin T will be released. So this is the cardiac marker in the diagnosis of damage to any heart muscles. Question number 46. Among these symptoms, which is not due to right-sided heart failure? Option A ascites, option B distended jugular vein, option C is orthopnea, option D is weight gain. Which is the not the symptom of right side heart failure? The right answer is orthopnea. Orthopnea is the symptom of left-sided heart failure, whereas ascites, distended jugular vein, and weight gain are the symptoms of right-sided heart failure. Question number 47. The sign of retroperitoneal hemorrhage is known as option A. Cullen's sign, option B. Great Turner's sign, option C is Homan's sign, option D is Hoover's sign. So first we want to know what is Cullen's sign. Cullen's sign is an indication of pancreatic necrosis with retroperitoneal or intra-abdominal bleeding. Usually the Cullen's sign is accompanied with Great Turner's sign. Great Turner's sign is known as bruising of the flank. It is a sign of retroperitoneal hemorrhage. Homan's sign. It is the dorsiflexion sign of deep vein thrombosis. Homan's sign is the dorsiflexion of sign of deep vein thrombosis. And what is Hoover's sign? Hoover's sign of leg. It is leg paralysis sign. It is maneuver aimed to separate organic form and non-organic form of paralysis of the legs. So the right answer here, Great Turner's sign, which is known as the bruising of the flank. It is a sign of retroperitoneal hemorrhage. 48. DAS is a surgical procedure used to remove the atheromatous plaques material or blockage in the lining of an artery. Option A, endarterectomy. Option B, angioplasty. Option C, radiofrequency ablation. Option D is transmyocardial revascularization. DAS is a surgical procedure used to remove the atheromatous plate material or blockage in the lining of an artery. The right answer is endarterectomy is the surgical procedure. 49. Image based question. See the image and answer the name of this equipment. Option A, ultrasound sonogram. Option B is colposcope. Option C is urethroscope. Option D is hysterosalpingography. So this is the instrument. Which instrument it is? It is a colposcope. It is a colposcope, and the procedure is known as colposcopy, is used to closely examine your cervix, vagina and vulva for any signs of disease. Now question number 50. While measuring patient jug, jugular venous pressure, the patient neck is reclined to which angle? Option A 90 degree, option B 45 degree, option C 60 degree, option D 30 degree. The patient neck is reclined to 45 degree when you measure jugular venous pressure. Question number 50. The surgical repair of a defect in the vaginal wall is known as. The surgical repair of a defect in the vaginal wall is known as option A, colporrhaphy, option B, herniorrhaphy, option C, gastrorrhaphy, option D is salpingorrhaphy. So rhaphy means repair. So vaginal wall is related to colpo. So the answer is colporrhaphy. It is the surgical repair of defect in the vaginal wall. 51. Urea breath test is done to diagnose the option A Staphylococcus aureus, option B Helicobacter pylori, option C Staphylococcus pneumoniae, option D Klebsiella pneumonia. So urea breath test UBT. It is a rapid diagnostic procedure used to identify infections caused by Helicobacter pylori, a special spiral bacteria implicated in gastritis or gastric ulcer and peptic ulcer disease. It is based upon the ability of Helicobacter pylori to convert urea to ammonia and carbon dioxide. So the test is used to diagnose the presence of Helicobacter pylori in our stomach, which will affect the absorption of urea. As a result, in our breath, the odor of urea will come. Question number 52. A non-invasive procedure used for checking oxygen saturation is option A aerometer, option B is hydrometer, option C is pulse oximeter, option D is hygrometer. The non-invasive procedure used for checking oxygen saturation is pulse oximeter. Aerometer is used to measure the density of air. Hydrometer is used to check the density of liquids, whereas the hygrometer is used to check the amount of humidity in the atmosphere. So pulse oximeter is used to check the oxygen saturation level. Question number 53. Normal urine specific gravity level is option A 2.0022 to 2.035. Option B is it is greater than 1.015. Option C 1.0022 to 1.035. Option D is 1.040 to 1.050. So here the urine specific gravity normal level is 1.00 to 1.035. If you are having above 1.0, that will be hypovolemic, that indicates hypovolemic, and the above 1.035, that indicates frank dehydration. So this is not the nearest level of normal urine specific gravity. 2.00 to 2.035 is totally abnormal level. Question number 54. Following cataract surgery, how long sunglasses need to be used? Option A 4 weeks, option B 6 weeks, option C is 8 weeks, option D is 12 weeks. Sunglasses need to be worn by patient in a post-cataract surgery for at least 6 weeks. 55. The visual field test that produces the map of your complete field of vision is called as option A tonometry, option B gonioscopy, option C is pachymetry, option D is perimetry. The visual field test that produces the map of your complete field of vision is perimetry. The right answer is perimetry. You should know what is tonometry. Tonometry is used to check our intraocular pressure. Gonioscope is used to assess the anatomical angle formed between the eyes, that is between cornea and iris. Pachymetry is used to measure the thickness of the cornea of our eyes. Question number 56. By 1 month of age, the baby gets how much ml of breast milk per day? The four options are 480 to 720 ml. Option B is 750 to 800 ml. Option C is 30 ml. Option D is 45 ml. By 1 month of age, the baby gets around 750 to 800 ml. So 480 to 720 ml of breast milk will be the baby gets by at the end of 2 weeks. At the end of fourth day, 30 ml. At the end of fifth day, baby will get 45 ml of breast milk per day. Okay. Now, question number 58. The enzyme study that is most specific to myocardial infarction is option A CPKMB, option B is SGOT, option C is SGPT, option D is LDH. The CPKMB, creatine phosphokinase, this one muscle and brain. So this is the most important cardiomarker to diagnose the myocardial infarction. It is a specific cardiomarker. Question number 59. Hydronephrosis means dilation of renal pelvis. Option B is constriction of renal pelvis. Option C, narrowing of renal pelvis. Option D is atrophy of renal pelvis. Dilation of renal pelvis will be the right answer for this question. Hydronephrosis means dilation of renal pelvis. As a result of that, the urine will not move from kidney to the bladder. Okay. Now, question number 60. Fresh bleaching powder contains 33 percentage chlorine, 3.3 percentage chlorine, 0.33 percentage of chlorine, 0.033 percentage of chlorine. Fresh bleaching powder contains 33 percentage of chlorine. This is the right answer for question number 60. There we come to the end of today's video. I am thanking you all for watching this Set to Carry You online nursing channel. Please subscribe this channel if you have not yet subscribed. I wish you all like my lecture. Please comment about my lecture in the comment box below. I again thank you everybody for supporting for the growth of Satu Carry online nursing channel. Soon we will meet with the another 20 questions of Safdarjung nursing officer model question paper. Now take care. Bye bye.